This is CBC Vancouver News.
Hi there, good afternoon. I'm Mike Killeen in the CBC Vancouver newsroom. Thanks for joining us online for this local news update. Once again, we've got a doctor coming on in a little bit to answer your questions, so fire away in the comments section. You know how to do that. But right now, let's get to the latest information on COVID-19 in our province. Health officials are confirming one new death in BC. It's connected to the outbreak at the Lynn Valley Care Centre in North Vancouver, and they are reporting another 40 cases of coronavirus, bringing the total to 271 across our province. The City of Vancouver has declared a state of emergency, giving it the power to maintain essential services and respond to this virus. And starting tomorrow, this is pretty significant, all TransLink buses are going to be free as the city introduces rear door boarding to allow social distancing. We're going to have more on that in a little bit. We know you have lots of questions about the outbreak. We've been doing this regularly on our program, so we're going to continue our live question and answer session. We've got a doctor coming on shortly on standby to bring you answers to your questions. Dr. Kathleen Ross, a family physician and the president of Doctors of BC, is going to join us in about 10 minutes or so. So here's how you get a hold of us. Call the number on your screen. You can see it there, or you can send in questions via email. Of course, if you're watching us on one of our many live streams this afternoon, you can also post your questions in the comments section. Okay, first up, let's get the latest on the COVID crisis in our province, joined by Tanya Fletcher. What do we know about, first of all, the one additional death that was reported?
Well, all we know is that it is connected to that Lynn Valley Care Centre in North Vancouver. And keep in mind, that's where we've seen most of the deaths in BC are connected to these outbreaks. Because a lot of people say, you know, Ontario only has one death, so why are we seeing so many in BC? There are 3 outbreaks at 3 separate care homes in the Lower Mainland specifically. And so that's where all of these deaths have been stemming from elderly people.
Right. We had the one at Hollyburn House, I guess it was, in West Vancouver, and then the reported case at the Harrow Care Centre in downtown Vancouver.
Yeah, exactly. And we did hear from Dr. Bonnie Henry today. You know, after we get these updates, every time we dial into these briefings, they give us kind of the latest number on the number of cases, any new deaths. And then it's interesting peeling back kind of the strategy behind the messaging that the province is trying to get across. Today, it was very fascinating to hear what I thought was Dr. Bonnie Henry's strongest words yet regarding the message to people. Here it is. Take a listen.
This is not optional, and I want to be very clear that everybody needs to take these actions now, and this is what's going to protect us for the next few weeks. It's going to protect ourselves, it's going to protect our families, and going to protect our communities. The importance cannot be minimized.
So some very strong words from Dr. Bonnie Henry there. She is trying to get that message across. Stay home unless you have to leave. And she did clarify again, you know, the social distancing rules. I don't know if we can do a 2-shot again with Mike and I, but they gave the illustration of using 2 arms lengths. I know I kind of have short arms. Right? Yeah, we're probably a little too close. Yeah,
but we get the idea.
But you get the idea. You're supposed to be this far apart, not touching. And so she emphasized again, you know, people were asking, can I still go to the grocery store? Because people are going to be in relatively close quarters. She said, yes, that is okay, because she emphasized that essential services have to stay open. People still have to eat. They need to buy food. And of course, with restaurants closing down, bars, nightclubs ordered to close, restaurants still have a little bit of discretion if they're able to operate within those parameters, the social distancing. And keep in mind, we still have the ban on large gatherings of 50 people or more. So as long as you're under that 50 people limit and you can maintain this, you know, the social distancing measures, then she says find creative ways to operate. That plays off what John Horgan said earlier this week, right? I asked the Premier, well, you know, you see a lot of businesses shutting down anyway, almost out of a sense of public shaming because they feel they shouldn't be open, even if they're a small coffee shop that can still do takeaway only. And he made it clear, you know, if you can operate and do it safely, then do so, because we still need to support our local businesses and the local economy. And so, yeah, so she said today, you know, despite the strong messages we heard from her, she said, go to the park, get outside, walk your dog, go to the playground with your kids. Don't hold play dates, don't invite people over for sleepovers, but maintain that social interaction. She said social distancing is key, but social isolation is not what we want, especially for seniors. So she said, get outside, get fresh air, get exercise, but do it safely.
And it kind of follows what the health minister was saying yesterday. I mean, he was pretty firm in his language, saying, look, it's not too late to join this fight.
Exactly.
They're characterizing it as a fight and encouraging us all to be responsible. I guess they need more curve flatteners. People to join the ranks of the curve flatteners so that we can, and I heard the federal health minister saying it was, they're trying to crunch the curve, not just flatten it out. Interesting firm tone from the province today, and some changes to MSP wait times. Is that right, for people coming back to BC?
Yeah, that's right, because the health minister was asked about this yesterday because, you've heard the federal government's call, come back now. And so the BC's health minister said today the MSP wait period is going to be waived for those returning from any of the impacted areas and intend to stay in BC. They're also waiving the wait period for those returning to BC, and it's found out that they were outside the province for actually longer than the allowable time to obtain that MSP coverage, so they're waiving that rule as well. Keep in mind, those with expired BC Services cards are also being told they can make arrangements to get a renewal without going to an ICBC office, as you normally have to do, right? Get a new photo ID card. That can be combined with the driver's license, so now they're making that rule kind of more acceptable.
Okay, so you don't have to physically go into the office. So how did they do the photo there? Can you send it a photo?
Yeah, to be honest, I don't know. That's a good question. We'll have to find out exactly. And before we wrap up here, I want to show you a photo, if we still have this picture, talking about businesses that are still operating within those parameters. I popped out to my local market this morning and I found this in my bag when I got home. We can deliver, look at that, through WhatsApp. They're saying DM me. Keep in mind, this is not a big box grocery store, like Save On Foods and those kind of chains, grocery store chains have been set up for a long time to do home delivery services. But mom and pop shops like this, it's a family run independent business, are now doing what they can to help customers because they know they need to get food out. And, we heard again today the message, the supply chains are strong. Don't worry about hoarding. But grocery stores find ways to keep your customers fed, essentially.
People have been sending in questions, not just to us about related to the doctor that's coming up, but also to ask you a couple of quick questions, just if you've got time here. Aaron asking, any info on economic relief? We've heard the Fed's plan. Is there any relief coming from the province? That's
a great question, because that's what the province, the finance minister in particular, had said all week, right? We need to see what the Feds are doing first, and then how can we funnel that money to British Columbians through the provincial level. So we are expecting Monday. Many of those questions will be answered. As we mentioned yesterday, a quorum of MLAs, that means kind of the minimal number of members needed at the legislature, will return briefly to the House. There'll be 12 of them, including the Speaker, members from all three parties. That's so they can pass emergency legislation, and part of that will be under the Employment Standards Act to help workers and prevent layoffs, essentially.
All right, look for that on Monday. Tanya, thanks very much.
You bet, thank you.
Okay, and it is official. The City of Vancouver has now declared a state of emergency, a unanimous vote by council. It's at a time when municipalities right across the province are trying to figure out how to adapt to this pandemic. The CBC's Justin McElroy is with us now for more on this. He can also answer any questions you may have about the local state of emergency here, so feel free to send them to us over social media, either by email or phone. Justin's going to be with us for a little bit here. Okay, let's start, Justin, first of all, with the state of emergency. What power does it give the City of Vancouver?
Yeah, well, there's a few powers that they're asking the provincial government to give them now that they've declared this emergency. One of them is to be able to enter into any building that they want. One of them is to be able to expedite purchasing anything that they need in terms of equipment or supplies. And the other one is to take over, not just to go into, but to take over any building or any part of the building that they want to during this period. Now, they say that the reasons for this at this point aren't going to be broad. It's going to allow them to be nimble. But we're talking here about things like being able to take over small parts of buildings to self-isolate the homeless and most vulnerable, for example. Or we're talking about if the city realizes that one area or one neighborhood really needs some critical equipment to help make sure that outbreak doesn't transmit very quickly from block to block. example, that they can get the equipment they need to people in those areas. Again, their focus is on the city's most vulnerable populations, the homeless, the people that are living in SROs, the people that don't have a fixed address, and that these sorts of powers that they're asking for from the province will go a long way for them to be able to do that. Because keep in mind, the city has thousands of employees. They can fast track going into different neighborhoods much faster than provincial health officials can.
Okay, and just maybe a logistics question. Did they all show up at 12th and Cambie to vote on this today?
No, so they had a special virtual council meeting. So Kennedy Stewart was chair in the middle of council, and there were a couple of staff members in that big room as well to help with logistics. But otherwise, all 10 councillors, they voted yes for this emergency, but they did it from the comfort of their own home, practicing social distance. Some of them had some problems with their monitors and getting conferenced up, as so many people are these days. But this will be the norm for a while from a city politics standpoint in the city, while the public hearings and licensing boards and things like that are completely canceled. Most municipalities are hoping to keep up with the basic business of council meetings, but they're hoping to do so by having them take place virtually. And so this was the first step. Some technical issues today, but otherwise the city was able to conduct the legal business they needed to in order to not only pass that emergency motion, but also another motion to fast track a lot of the community grants that they approved for 2020. They needed to change some wording to fast track the money that actually goes to those social groups. So both of those things happened at council today.
Okay, and just quickly, are you up to speed with what was developing in Surrey as well? The mayor spoke there as well?
Yeah, so all municipalities are taking slightly different tacks at this point in terms of what they're doing. Surrey Mayor Doug McCallum is saying it's, encouraging people to still go outside and to enjoy playgrounds and the. He said that 2 daycares in city-owned facilities will be closing down unless the families of first responders are there, as well as all day camps. That goes into place Monday morning. But it's different everywhere you go. Surrey City Hall is remaining open. A lot of other ones are closing at this point. The city of Port Coquitlam has decided to shut down all playgrounds because they saw a few situations where too many kids essentially at once were on playgrounds and there's not cleaning stations there. So it's a really fluid situation from municipality to municipality. But no matter what you hear from local mayors, they're saying the same thing at the end of their statements. Practice social distancing. Don't go out if you need to. Continue to follow city websites for the latest of information of specifically what buildings are completely shut off or not.
All right, practicing social distancing, one of the very things you are doing this afternoon, working from home and providing us with that information. All right, Justin, thanks very much. We appreciate you joining us.
Thanks, Mike.
All right, let's bring in our doctor now and get your questions to her. We're going to take COVID-19 questions for, we've got some time here, 8 or 9 minutes. And again, you can send us an email, give us a phone call. I think we've got the numbers up there. Yes, we do. And of course, you can contact us online, Facebook, YouTube, or Twitter. And we're going to try to get to as many questions as we can. So joining us now is Dr. Kathleen Ross, a family physician in Coquitlam and president of Doctors BC. Dr. Ross, thanks so much for joining us this afternoon. We appreciate it.
Happy to be here, Mike.
Okay, you just may have heard Justin talking about the playground situation. That's one of the questions we've got here. I'm just going to get my laptop sorted out, but questions about whether it's maybe time to close playgrounds. I think in neighboring Port Coquitlam, not from you, they've already taken that measure, but what's your feeling on playgrounds?
So I think we need to encourage families to keep their children as separated as possible, and social distancing from other children is simply an extension of that. If we need to close playgrounds to reinforce that particular behavior, that's great. There's a lot of other ways that we can get out and move around without having to be in such tight quarters that puts us at risk.
Okay, people also wondering about the possibility of closing daycares. Can you tell us about the situation there and perhaps the risk that they represent?
So we see a similar challenge, of course, dealing with children in daycare is that they're often quite close together, and I find that there is a challenge keeping kids separate in that sort of circumstances. I have a number of patients that work in the daycare business, and they're finding that fewer and fewer parents are actually enrolling their children in daycare at the moment, and oftentimes the workers are staying home as a result.
Okay, Nikita called in. She has an autoimmune disease and has been taking immunosuppressant medication for 20 years, but aside from that is perfectly healthy. She's wondering whether she should be practicing the same precautions as someone else with a more seriously compromised immune system. It's a good question.
So it is an excellent question, and vulnerability in our patients isn't just seniors, and we recognize that there are people with underlying lung conditions, as your callers pointed out, immune conditions, where you'd want to have that little bit of increased vigilance, and perhaps look to your neighbors, look to your friends to pick up your medications for you, to pick up your groceries for you, drop them at their front door in a way that you don't need to be in direct contact with them as you pick up those materials that you need, and really stay home, practice all the best hygiene that you can, washing your hands frequently, not touching your face. These are really the ways that you're going to get through this.
Okay, I asked people to tweet me earlier today with their questions for you. Here's one from a person on Twitter wanting to know, how will my wife's pregnancy checkups and studies be affected? She's fine, but they just want to be sure not to interfere with the COVID-19 response.
So as luck would have it, I actually work in one of the high volume obstetrical clinics in New Westminster, and we are doing everything in our power to practice social distancing inside the clinic. It's critically important that we don't have large crowded waiting rooms, and we're making adjustments to our call protocols and how we bring people in to ensure that that doesn't happen. Pregnancy is a time where you do not want to be skimping on care. We want to make sure you get your ultrasounds and your blood work done on time. And we want to ensure that you have access to regular follow-up with your primary care provider.
All right, thanks for that. Another question, this one from Justin, asking, what about if you have asthma and allergies and you're prone to bronchitis? Are you considered high risk?
Well, I think that would be dependent on how controlled your asthma and your lung condition is, and to what extent the diseases that you have are. Hard to answer. Are you at greater risk? Anyone with an underlying condition, of course, yes.
All right, we're getting some interesting questions this afternoon. Howard is asking if we can fact check something he's heard. Does gargling with hot salt water kill the bacteria in our throat?
No, unfortunately it doesn't. And we see a lot of really potentially dangerous solutions floating around on the internet. Honestly, folks, if there was something that I could give you that would help to reduce your risk or improve your situation, I would be out there announcing it to the world.
All right, Nancy is asking, or saying she works at a modular housing building that houses 46 folks who are homeless and face multiple health issues. Staff are essential. It's not an option to work from home. So how, as a staff member, can I protect myself?
So frequent hand washing is really critical. This virus, by and large, you need to take off of a surface or off of respiratory droplets and touch your face, around your mouth or your nose, and to introduce it into your body. So by keeping a distance of 1 meter, minimum 2 is better from individuals who are unwell. Absolutely can be part of the protection, but hand washing frequently and not touching your face really is critically important.
All right, Anthony has sent us an email asking, can we still go on dates with our boyfriend, girlfriend? Are we allowed to kiss, or should we exercise social distancing?
Well, that's a tough one, actually, and I know that lots of folks are getting creative. Obviously, for families that live together, it's a little more challenging to social distance, but not impossible. If you have an opportunity to socialize in another venue other than face-to-face, I think I would encourage that for the moment.
All right, let me just scroll down a bit here. Pearl called, and this question has been asked of Bonnie Henry and the health minister. Is BC still at low risk for COVID-19?
So COVID-19 is a reality here in British Columbia, and that's why we're seeing daily more and more stringent protocols put in place. And I think Dr. Henry was very adamant and strong in her words today. And I will reiterate that we all have a responsibility here. We all play a role, whether you're a government official, a health care official, a doctor, a nurse. are running around in the public. Everybody's got a role to play here to try and flatten this curve.
Okay, a Facebook user is wondering what the difference might be between reported case numbers and the actual number of people who may have COVID-19, given that the testing isn't, as we know, universal.
It's an excellent question, and the hard fact is that we are not going to be able to test everyone here in BC. We're preserving those tests so that we can have them for those who are most likely to require hospitalization, including late trimester pregnant women who may be unwell. We want to emphasize healthcare workers so that we know that they're safe to keep caring for patients, and have the test turnaround time be reasonable to influence those decisions.
Okay, and one final question. Michael is wondering, is this a virus that shows some weak symptoms for a short period, lies dormant for a week to 10 days, and then blooms into something like a heavy pneumonia?
So again, we're learning so much more about this virus as time goes by. Some patients have very mild symptoms for the duration of their illness, when other people are hit very hard and very fast. The average incubation period is anywhere between the 5 and the 14 days, as we've heard from Dr. Henry many times. But there is a whole spectrum of illness out there. When we're triaging patients on the phone, we're just telling anyone that's suspicious, stay home, self-isolate. Don't share your infection, even if it's not COVID, with your neighbors.
Dr. Ross, thanks so much for being with us this afternoon. We appreciate it.
You're very welcome. Thanks.
Dr. Kathleen Ross, a family physician in Coquitlam and president of the Doctors of BC. You, sir.
Hello.
We're back.
I'm back. I'm
Good.
doing well. It's a spring day. Happy spring, everyone.
This is the first day of spring, right?
First day. We've got a couple of hours to go. I think it's technically 8:49 p.m.
Yeah.
That's when the equinox happens. But I mean, looking outside right now,
Feels like spring.
Feeling spring-like, and that's going to last all the way through tomorrow. So if you've been enjoying it, and I think as we heard today, I mean, Dr. Bonnie Henry herself saying, go out to a park. Like, as long as you are going to be maintaining your social distance, like we are now. I mean, we could do a little better. But in general, yeah, as long as you're maintaining your safe distance, we have such a beautiful environment around us. Being able to take the time to go is pretty cool. Now, interestingly enough, I put out the question as well today to see if there was anyone that had weather-related questions, and this one is actually COVID and weather-related. And I want to bring this up because it was Maggie on Twitter. She wants to know if the warm weather that's going to be coming soon is going to help stop the COVID virus. Now, this is something that I've specifically looked into, and it's the tricky answer to say here is that we don't know specifically when it comes to COVID, but when it comes to historical illnesses like influenza, there is a noticeable decrease when it gets warmer. And the reason for this, a respiratory illness, it's harder for those droplets, or the illness itself, the virus, to stay sustained within the air. It's warmer, it's going to evaporate faster, and that's going to be less able or less likely to be able to be ingested by you. So there is definitely a decrease that happens when it gets warmer, but it's worth saying for countries like Brazil and Australia that have already been in their summer seasons and they still have reported cases, it's clear that temperature alone is not going to be sufficient to stop that. So we're definitely still, like, I'm reading as many papers as I can about this because it's a very pertinent question. So thank you so much for asking that. And yeah, as soon as we learn anything else, I'll let you know.
You got one more there, yeah?
Oh, yeah, and Macy was wondering, is it, with the beautiful weather and COVID right now, is it safe to go out to the parks? And yeah, just to reiterate, of course, Dr. Bonnie Henry, with her permission as well, saying that that is a good thing to do. So yeah, we still have another full day, beautiful weather coming, and really the change-up is only going to be happening more so onto the weekend. So that's when we're going to get a little bit more cloudy on Sunday, and then come Monday, I believe it is, that's when we're going to start to see a little bit of those showers return. But as it's spring, I want to show you some pictures actually that were taken today. Or actually, why don't we do this? I'll show you. I had this prepared. I forgot about it. In fact, this is what it means when we say it's the first day of spring, the equinox. This is when the sun is directly over top of the equator. So that translates to the fact that we're going to be getting roughly equal parts of daytime and nighttime now. And truly, every day from now on is going to have just slightly more daylight to it than night. And that's going to be continuing